Hey, Dr. Malloy, hello.
I've always wanted to be a nurse. I began visiting older people at their homes in our neighborhood when I was in elementary school. Just to be able to be with people at sometimes what's the most difficult time of their life, and to be a witness and to be able to ease suffering is just a privilege. When I met Dr. Malloy, he was very sick and had been in the hospital for many days and had a lot of pain. It takes a lot more time sometimes to care for an older adult. Oftentimes people have acute infections, become delirious and can become confused. If I hadn't had that moment with him, things could have turned out much differently. And that's why being able to provide this extra role to be able to help support them while they're in the hospital is really important work.
I'm very grateful to that for my life. Well, I think that nurses are the support mechanism of the whole machine.
Patients are living longer, and there are a lot of advances in science and technology, and so making sure that nursing knowledge aligns and remains abreast with that is extremely important to making sure that we're providing the best care for our patients.
Having this role and this opportunity through the foundation enabled me to be able to do research that I never would have been able to do before, expand a geriatric nursing program that spans the entire hospital, coordinate the program niche, which is Nurses Improving Care for Health System Elders. Through that, we educate nurses to specialize in the care of the older adult, as well as support the program Prime, which works with frail older adults undergoing surgery.
This is a relatively new field, so we're still collecting a lot of data, and there really isn't a lot of information out there as far as the outcomes of programs like this, and that kind of expertise is really valuable.
All right, so Mr. Adams, how are you feeling today?
Oh, pain level above 5.
I'm really excited to say that we have 106 geriatric resource nurses throughout the entire hospital. In a hospital our size, usually there's only about 2 or 3. So by having this program niche, we were able to really reach out to nurses to educate them so that they know to check for these subtle changes that happen in older adults and to get to know their patients in a very compassionate way.
Just give you a little preview.
One of the things I'm most proud of is being able to create an original position that Rosemary has to be able to provide more staffing for older adults that just need that extra time, that extra compassionate person to be able to not rush them, to understand that they may have some special needs, and to really connect with them.
The nurses really, I think, are the most important component, and really this program wouldn't be possible without nurses like Suzanne and Rosemary. They are really the spark that inspires all of us to do our best, and I think it really is so important that we continue to have support for those types of positions here at Sibley Hospital.
We are utilizing virtual reality with hospital nurses to increase empathy so that they can actually experience what it is like to be someone that has visual and hearing impairments. Without support of donors and grateful patients, so many of the programs and educational opportunities would not be in existence here at Sibley.